So hello everyone and welcome to the case 8 of the case discussion series today. So we'll be discussing two cases of intraparenchymal hemorrhages, and I want you to first diagnose which stage of bleed the patient is in. It is important to stage the intraparenchymal hemorrhages on MRI, and it has been asked in the NEET SS exam in 2023 as well. So this is important, and so we'll be discussing both the cases. Two cases are there and we'll be discussing both of them. So we'll be discussing two cases, and both the cases are there in this particular video. We'll be starting with the first patient. This patient presented with both the patients have hypertensive bleed. So this is the T1 weighted images axial section, where we can see that there is a hyper intense bleed involving the thalamus and the capsuloganglionic region on the left side. Now these are the T2 weighted images axial section for the same patient, where again we can see this hyperintensity, predominantly hyperintense with peripheral hypointensity, with some chronic ischemic changes which are seen in the bilateral centrum, semi-ovale and periventricular white matter, and also some age-related generalized brain volume loss. These are the FLAIR images, where we can see again predominantly hyperintense bleed with peripheral hypointensity. These are the DWI images. So on DWI, there is hyperintensity which is seen in that particular area. Now we'll compare with the ADC map if it is showing reversal. So yes, there is hypointensity on adjacent ADC. So the area is actually showing restriction. And this is the GRE axial section of the same patient, which is showing peripheral blooming. Now this is the second patient. Then again we're starting with T1 weighted images axial section, where we can see this particular hyperintensity in the anterior insular cortex. Now this is the axial T2 weighted images of the same patient, where the area is predominantly hypointense. So it's T1 hyperintense and T2 hypointense. These are the GRE images where there is intense blooming. And this is the DWI, which is black. The area is black on DWI as well as on ADC map. So by now you should be able to tell that which stage of intraparenchymal hemorrhage both the patients are. The second patient, I'll also be showing the angiography image. So this is the angiography axial section. Actually, the clinician actually diagnosed it as a hemorrhage, he was suspecting an aneurysm of MCA. So this was sent for a review. So here this was not an aneurysm because he saw the 3D angiography images, and he thought that there is some outpouching of the middle cerebral artery, but as such there is no outpouching. It is just that intraparenchymal hemorrhage adjacent to the artery is seen on the 3D weighted images. So this is the report given for the first patient. It was a well-defined area involving the left thalamus and capsuloganglionic region, which appears hyperintense on T1 as well as T2 and exhibits peripheral blooming on GRE and shows restriction on DWI with reversal on ADC. There is surrounding edema seen on flare sequences causing mild effacement of the third ventricle, and these features were suggestive of late subacute intraparenchymal hemorrhage. So this is the second patient report that I gave. That's a well-defined area involving the left insular subcortical white matter as well as the anterolateral aspect of the left lentiform nucleus, which appears hyperintense on T1 and predominantly hypointense on T2, and there is intense blooming on GRE, and it appears dark on DWI as well as ADC. And there is no such surrounding edema on flare that was seen, and where features were suggestive of a early subacute bleed. There was no outpouching from the MCA or its branches. There was just an intraparenchymal hemorrhage adjacent to the distal left M1 segment of MCA, which was observed on 3D format. So this is an important, very important slide for the stages of intracranial hemorrhage. Hyperacute bleed, that is within 24 hours, is composed of oxyhemoglobin, where it shows blooming of the rim on GRE images. Stage 2 is acute, that is deoxyhemoglobin, which appears as increased blooming on GRE sequences, and about 1 to 3 days is the time period for acute intracranial hemorrhage. Then comes early subacute, that is from 3 days to 1 week, where it is very dark on GRE images because of the intracellular methemoglobin. Then the fourth stage is late subacute stage, which is from 1 week to months, and because of the extracellular methemoglobin, it has a dark rim and a variable center. So our cases were of early subacute and late subacute bleed. The early subacute was showing intense blooming, while late subacute had predominantly a dark rim with variable center. Then the fifth stage is actually a chronic stage, where it is months of bleed, where because of hemosiderin it appears completely dark on GRE sequence. The important thing to be remembered here is that hyperacute and late subacute stages of bleed show restriction on DWI with reversal on ADC. So this table I have prepared from this chart from Osborne, where they have described the stages of bleed and the appearances on different sequences. So here is another case that I came across, where a 51-year-old male with uncontrolled hypertension came with severe headache since last night, and this is the MRI done for this patient. These are the axial T1 weighted images, where we can see that there is isointense area in the right capsuloganglionic region. On T2 weighted images, it is a bit hyperintense with surrounding edema and effacement of the right lateral ventricle with midline shift to the left, and on GRE there is intense blooming that is seen. On DWI there are areas of restriction that are seen, few areas of restriction on the corresponding ADC. Here we can see that. So this bleed was in a hyperacute stage. This is the report that I had given, that the well-defined area noted in the right capsuloganglionic region, which appears predominantly isointense on T1, hyperintense on T2, exhibits intense blooming on GRE with some areas of restriction on DWI. So hyperacute and late subacute stages of bleed show restriction. There was surrounding edema which was seen on flare with effacement of the lateral ventricle with midline shift to the left, suggestive of hyperacute hemorrhage.